Hello, I'm Gail Devins with the Easton Chamber of Commerce. Welcome to another edition of Consider It Local. I'm here at Compass Medical with the Chief Executive Officer, Jamie Barber. Nice to meet you, Jamie.
Nice to meet you, Gail.
Yep. So I noticed that as I drove here, that we're actually in the office part of Compass Medical, right? This building?
Yes, this is our business office.
This is a business office.
Yep.
Okay. All right. And so where I went, my GPS took me to the actual facility.
Yes, right next door.
Yes, and I was very impressed. I'm actually glad I went there because I was able to see how everything was running, and it seemed to be running very smoothly. And I went into the MRI office, and I was very thankful that I actually didn't need an MRI. But
me too.
So I went in there, and they directed me here. So
good. Well, I'm glad you get to see the facility. That is our flagship facility next door. We built that in 2007. And we're very excited to have that be sort of the anchor of Compass's geography. That was one of the first of 6 buildings we built in 7 years between 2007 and 2013.
Is that right?
So we went from there to building the one in Easton, then in Middleborough, and Halifax, and then Quincy and Braintree. All between 2007 and 2013.
Are you kidding me?
It was a busy time.
Oh boy. And so how many facilities do you have at this time?
We have 8 facilities.
8 facilities.
Yeah,
okay.
We employ about 550 people in those facilities, including about 65 in our Easton facility.
Is that right?
And we have 9 primary care docs accepting new patients there, and a 6-day-a-week urgent care walk-in center that anybody can go to, not just Compass patients. If you're a HMO patient, if you get a referral from your primary care doc, you could be seen there on a Saturday afternoon just walking in and wait about 10 minutes.
I didn't realize that. And did you say that one is in Easton, that urgent care?
We actually have 4 urgent cares, including one in the building you were just in, and that's 7 days a week. And we're open 7 a.m. to 7 p.m. Less hours on the weekend, but 7 days a week there. We also have an urgent care center in our Quincy facility and in our Middleborough facility. And all told, we see about 1,000 urgent care visits a week, just walk-in visits.
Do you really? A week?
A week.
1,000?
In those 4 facilities combined.
Wow. So 4 of your facilities are urgent care.
Yep.
Okay.
Well, actually, the facilities themselves, we build around an urgent care center and primary care to give really access to patients. That's the biggest challenge in healthcare today, is being able to get in and see a physician. And that's why the urgent care centers give us a wonderful opportunity to connect with our patients who can't wait for that amount of time. So you can walk in, be seen with a full electronic medical record, supported physician or nurse practitioner, be seen in about 10 minutes. And, you know, that's a lot of visits that otherwise would have gone to the emergency room. So we're very excited from a public health perspective to be able to give patients options, and in their backyard too, which we think is very important in the community.
There really is. That's amazing. So what, is there a difference between, say, there's an urgent care in Easton that was just put in there, not in Compass Medical. Is there a difference between, say, if I went to that one versus the one that you have in Easton on Bristol Drive? I mean, you know, what's the advantage of you having one in your facility?
Well, for a few reasons. First, it's where our patients are used to going. So if you have a primary care doc, that's where you're used to being seen. We have the ability to support our urgent cares with on-site diagnostics, including laboratory, including x-ray. And that is a significant help because you see a wide variety of patients in a walk-in urgent care setting. And if you don't have that support, you're not going to be able to give the patient the quality of care they're looking for, which is in no way to denigrate the recent opening of the urgent care center down the street. But again, that's where we feel like the brand of care that Compass provides differentiates us from our patient's perspective.
Oh, okay, yeah, that's very good. That's excellent. And so, so the number, how many providers are there again?
We actually just went over 100 providers at Compass Medical.
100 providers?
Yeah, we got about 55 physicians and about 45 non-physician providers, including nurse practitioners, physician assistants, behavioral health therapists, podiatry, nutrition, diabetic education. Really, we're looking at providing the entire community of primary care and primary care related services.
So you have everything.
That's what our goal is, to be able to provide our patients one-stop shopping in a medical destination facility.
So that's nice, because if I had an infant or if I had an elderly parent, I could go to the same building because they could see geriatrics, they could also see the infant care.
Absolutely, and we
you know,
partner
so-
with Steward Healthcare to provide a wide range of specialty services in our facility as well, including the specialists that come down from St. Elizabeth's Medical Center,
Oh, really?
from Good Samaritan Medical Center, from Morton Medical Center. So we're very happy to have that affiliation and really be able to provide Compass patients one-stop shopping, even if it's not services that Compass actually provides, but we partner with an affiliation group to provide those services.
Okay, so Steward Healthcare, that enables you to do that. So that was an advantage of joining with Steward, or Steward joined with you in doing that. And when did Steward actually come on board?
We joined the Steward Network in April of 2012. So we just celebrated our 4-year anniversary as part of that affiliate partnership, and it's working quite well to be able to partner with Good Samaritan Medical Center, Morton, Kearney, St. Elizabeth's Medical Center, all the quality specialists at Steward Medical Group. It really gives us the breadth and scope that our patients are looking for when they're choosing a primary care provider. And I do think, as you said, that one-stop shopping is an important perspective. If you need a mammogram, a CAT scan, an MRI, as you noticed, any lab work, cardiology, primary care, nutrition, podiatry, diabetic education,
too.
all next door in that facility, as well as in Easton and Middleborough and Quincy.
So Easton has that as well?
Easton does indeed at Bristol Drive.
Oh, that's excellent to know, because since this is an Easton program here, so we all know, that is very good. And I thought I read something about Compass Medical getting an award for diabetes, some kind of...
I wish we had enough time for me to list all of the awards
Oh,
Compass has
do you
received.
really?
But yes, we pretty historically and currently have outperformed our peers when we look at NCQA, the HEDIS, all of the quality recognition from federal boards and from insurers, the payers. They recognize, you know, what we do, which is healthcare is a growing part of our economy, and healthcare technology is helping move forward, and those who can embrace it can outperform the marketplace by providing better quality of care, and the patients recognize that. We get better outcomes for our patients, and that's what it's really all about.
Oh yeah, that's excellent. That's so good. Wow. And as far as, so say I decided, okay, I'm tired of going to the doctor, and then they say, okay, well, we would like to have an x-ray done. So they send me over to the hospital to get some kind of ultrasound or something. So would your facility have that in-house where I don't have to go to the hospital to get the ultrasound done?
Absolutely. As much as we like working with our affiliate partners at Good Samaritan, at Kearney, at St. Elizabeth's, at Morton, our goal is to keep patients healthy and to keep them out of the hospital if we possibly can. And we view that as the primary challenge for primary care. You know, primary care docs are the ones who are on the front lines of the chronic disease battles. You know, we're just seeing such an epidemic of type 2 diabetes, chronic kidney disease, COPD, CHF, all these chronic illnesses. And it's as much lifestyle as other things, particularly when you look at a disease like type 2 diabetes, where if you work more closely with your healthcare delivery team, not just the primary care doctor, but also, as we said, the nutritionist, the podiatrist, the diabetic educator, we see better outcomes. We see patients' health improving, and that's really what keeps us going. It's a great time to be in healthcare because primary care now has the opportunity to really make an impact on what is driving such a disproportionate amount of the cost of healthcare delivery. So it's very exciting times.
Yeah, that is very good. And so, so I would still see a primary care, like say a family medical doctor type. And then because I'm finding that some people want to go just direct to the specialist, you know, direct to, this one specializes in whatever, orthopedic or anything like that, instead of first seeing the primary. Do you think that it's important to see a primary doctor first before you see an orthopedic?
Well, I think primary care is uniquely positioned to really help patients deal with not just illness as it comes, but maintaining wellness, prevention. And so having a relationship where you're seeing your primary care doc, at least for a physical on an annual basis, will go a long way towards preventing those illnesses. And in the horrible situation where, a really severe illness comes on, the sooner you can catch it and identify it, the better the prognosis is. So certainly, if you were diagnosed with something as dire as lung cancer, the primary care doc is going to, sort of step back and let the oncologist work with you. But still be a critical part of that care team because it's the continuity for many of the patients. And again, if we're doing our job well, not lung cancer, as that's not as preventable as we might like, other than not smoking. But that's where primary care can really help make a difference and truncate illnesses, but much more often and much more importantly, avoid them altogether.
Yeah, that sounds good. And as far as you mentioned oncology, do you have oncology in there or in the buildings where someone could get cancer treatments, or is that a totally different
Well, we've worked with Steward Healthcare to provide oncology specialty referral services at some of our facilities. We also do work with South Shore and Dana-Farber up the street in Weymouth, as it's hard to get away from that brand name in this part of the woods when it comes to cancer care. It's pretty much known as one of the brands you'd want to go to. So we work with our patients' family to recognize and appreciate their choice, but get them to the highest quality specialists we have access to.
Excellent. And you mentioned the one-stop, one-shop thing, and so I would imagine that this doctor communicates with this doctor, and so it's more of a team work?
Yes.
Would you say?
Yeah, I think really for healthcare, and you look at all the changes that have gone on, just in President Obama's time frame with the Affordable Care Act, we have now some 30 million more Americans getting healthcare coverage than they had. And for us in Massachusetts, we've already been there, because in 2006, with the creation of the connector products, we have less than 2% of our population in this state uninsured. So we're sort of the canary in the coal mine to a certain extent of what is an access crisis in this country. And putting 30 million more Americans on the insurance rolls is great, but if there aren't physicians to be able to see them, and that's where the challenge comes to your question is, if it's just the physicians, we're setting ourselves up to fail. We need to be able to provide team-based care. And the more we understand of chronic illnesses, the more we recognize that the treatment isn't just what happens in the room, but it's the checkups between. It's the ability to talk to a nurse case manager when you're in distress. And those are all things we provide at Compass Medical. We also have a very active patient portal through our eClinicalWorks relationship. So if you had a test next door, pretty much the next day you'd be able to get your results right on the portal. The patient portal is called Helo. And that it's a tremendous tool. I think as we see technology play a more active role in healthcare, you look at IBM Watson and what's going on in the UK with Google DeepMind, as that sort of artificial intelligence and quantum computing is brought into healthcare, it really is going to be a game changer in really individualizing treatment plans for patients. And as that subspecialization comes, again, the ability to have access to a team, whether it's online, that's something that we're very excited to be pioneering the use of telemedicine. That's something we expect to be doing this year.
I was wondering about that. Telemedicine, can you expand upon that? Because that really interests me quite a bit.
Well, and it's exciting to see what's going on in healthcare, particularly with technology in areas like telemedicine. Right now, there's websites and there's apps you can download where you can do an instantaneous dermatology visit. You can take a picture of a mole.
Oh, boy, really?
And for $50, you transmit that via text to an online physician, a dermatologist who's going to review it and tell you it's either nothing or you need to be seen. And that's not just dermatology, that's really taking hold in the healthcare marketplace. And I think as a capitalist, it's exciting to see supply and demand and the market responding to the need. The Mass Medical Society predicts by 2020 we're going to have a shortage of about 225,000 fewer primary care docs than we need.
Is that right?
But the market will respond to that, and that's what we're seeing with telemedicine. Teleradiology, that's been around for decades already, where you have people, in India who could be reviewing your radiology digitally and, provide high quality care, maybe not as much from a patient care perspective as having that radiologist in front of you.
Yeah.
But for access, for technology, and for streamlining the healthcare delivery system, I think there's so many exciting new opportunities that are coming in. And I do expect it's all going to result in better patient care.
Yeah, I mean, and just the fact that if you can send off, I'm questioning this mole on my elbow, and you send that off versus, okay, I need an appointment to come in. Oh, well, we can't really schedule for another month or two. And then you wait, you finally get in there, and then they look. I mean, so it must make things a little quicker to be able to do that.
Absolutely, absolutely. And that's, again, the challenge we face with everybody getting insurance coverage. When you pay for something, you want to get value out of it. And so a lot of patients who maybe hadn't been going to the physician's office because they couldn't afford it, or were putting off preventive care, now through the coverage, they're going to want to go get that service. And so what already was an access problem becomes an access crisis. And so again, that's how we can respond through walk-in urgent care centers, through digital means like Helo and the patient portal, and through telemedicine. And there's so many vendors out there who provide the technology platform to be able to provide it. So I think I'll be surprised if in 5 years we're not seeing a third of all primary care visits being done digitally or through telemedicine.
It's amazing because friends and myself, we were kind of kidding around about FaceTime. Said, oh, this FaceTime's great. You can probably go to the doctor through FaceTime. We're laughing about it. So here we are talking about setting things up. That would be great. The privacy of your own home, of course. But
of course, and again, I think that's where we do have, with all the regulation in healthcare, the ability to provide these services safely. Respecting HIPAA. And having to make sure we're protecting our patients' information, both from a health and from a personal financial perspective as well.
Yeah. So there's that avenue too you have to think about. And so sounds like Compass Medical is really on the cutting edge with technology and the way things are moving in the medical industry, how quickly things are moving, and you're looking, it seems to me you're looking into the future too.
I think we have to be. It's a service that is only growing in importance as the chronic disease explosion continues. And type 2 diabetes, you look at that in particular, we got to get in front of that. And there's not a magic drug out there that's going to reverse it. It comes down to dietary habits, it comes down to health choices and personal choices. And the more we can support that, and again, that's why we have a significant number of clinical social workers at Compass as well, recognizing that healthcare is not just about illness treatment, but about healthcare promotion, and that includes, behavioral, it includes mental health issues, and the importance of really looking holistically at the whole body, the whole patient, rather than saying, oh, well, you have a specific problem that we're going to treat. That's sick care. We want to be healthcare.
Okay, and I like that holistic approach. It's the whole person.
And the mind is a tremendously powerful tool for both healing or making you less well.
So true.
Depending on your state of mind. And that's where we look to treat the whole patient, not just the illness that's being presented.
Yeah, it sounds like this is the way that things should go.
Indeed, and as technology gets more ingrained in healthcare, we're going to see more and more things that today we're not thinking about. Everybody has a smartphone on them. And today you can use that as a stethoscope. There's attachments you can do to do diagnostics. Really? Absolutely. The power
through the cell phone?
Through your iPhone. It's amazing what's out there. After this, Google iPhone medical devices, and you'll be stunned at what you see. There's things out there. There's a company called Augmedix who provides a service where one of the biggest challenges our providers have is keeping up with all the documentation requirements by the federal government for meaningful use reporting, the PQRS, Physician Quality Reporting System. So all of those require a certain level of complexity of documentation, which all providers had been doing anyway, but it's much more structured on how it needs to be done now from a regulatory perspective. And so there's things out there like this company that I mentioned, Augmedix, that uses Google Glass. And so a physician will go into the treatment room wearing the Google Glass glasses, and no paper, no computer. They're just doing the patient encounter just like this, with eye contact the whole time with the patient, rather than being distracted by a laptop or a tablet. Meanwhile, there's a medical student in India who's watching through Google Glass and doing the documentation So at the end of the day, the physician needs to just go in, review all their notes, make sure that everything was accurately accounted for, and then sign them.
Come on.
And that's legally compliant. It makes doctors far more efficient. It creates a better environment in the treatment room. And those are things that we're looking to add as well. And not all patients are going to be comfortable with things like that.
Yeah, right.
But that's where we respect our patient choices and want to provide as many tools to our providers to be as efficient and drive the quality outcomes that we're really looking for.
So the patients can have some kind of input in that. If they don't feel comfortable with, okay, so you're looking at me through these glasses and, you know.
Right, then the physician would absolutely have the ability to bring their laptop in and do a more traditional visit. And that's what's exciting as the millennials become more engaged in their healthcare and start seeing the doctors more often. They have very different expectations than our traditional Medicare patients. Now. And so we feel it's incumbent upon us to be able to provide the tools for our providers and for the patients to build that relationship in the way that's most comfortable for them.
That is amazing. I feel like I'm in the twilight zone or something.
Well, it's amazing because healthcare probably is one of those industries that nobody thinks of as significantly changing. Sure, the medical technology, the medical device, the pharmaceutical.
Right, that's all I thought about,
But you kind of have still that view of the, Norman Rockwell physician with the patient who they see throughout their life. And we think those relationships are critical, but we want to be more effective than those docs were then by providing the technology, the tools to customize patient treatment plans for the individual patient. And that's where we're seeing healthcare going, is that individualized approach, not just you have type 2 diabetes, but how is it manifesting with you, not just physically, but also from a healthcare, family, socio-demographic sort of perspective, so we can treat, again, the entire patient, not just the illness being presented.
Right, okay, so that's amazing. And so if I were to decide, okay, I like this whole thing about Compass Medical, they're on top of technology, they've got the whole holistic approach. What would you say my first step is to go to Easton? Do I just go, do I look up Google Compass Medical Easton and choose a doctor? Or
that would be my first recommendation, would be to go to our website, and that's www.compassmedical.net. Compassmedical.net. Yeah, it's a very robust website. We're very proud of it. It's just been redesigned this year, as a matter of fact. We have an excellent design team for that. Good. And it really gives a lot of the story of Compass. It gives a pretty good perspective of the breadth and scope geographically of the providers. We have pictures of all of our providers. Oh, you do? Okay. So you as a patient can see who's there. And if you can select a provider through the website, or all the contact info is on the website as well, to be able to request through the website physician and an appointment, or to go ahead and give the office a call. And we always welcome walk-ins. We want to see the facility as well. And again, in Quincy, Easton, East Bridgewater, and Middleborough, we have urgent care available for a walk-in. So
that is really good to know. And I like that you said you don't necessarily have to be part of Compass Medical right away to go to the urgent care.
Correct. Now, if you have an HMO plan, you're going to want to get a referral to be seen there by your current primary care doctor.
Important to know.
If you're a non-Compass. And another important distinction is you will never pay an emergency department copay in our urgent care visits. It's the same as if you were seeing your primary care doctor. Is that right? There are certain insurance plans that don't view it that way, but by and far the vast majority of them all differentiate with the emergency department, which is much higher than what an office visit copay is. Definitely. And you usually will wait no more than 10 to 15 minutes, which is a little more in emergency department.
Yeah, and not only that, when you go to Compass Medical, it's not just the atmosphere, because when you walk into a hospital emergency room, you're instantly tense. You know what I mean? It's just, and so if you go into this, it's a regular building, and you're walking in, it's comfortable, and that kind of just lowers the blood pressure right there.
And that's the goal. That's how we design the, it's hard when you have something called a waiting room, because what's going to happen? You're going to wait. Yeah. We really try to not only reduce that, but in all of our waiting rooms, you'll see televisions, coffee, water, as we've seen. Most industries transforming themselves to be much more customer friendly. Healthcare needs to do that as well. It's been far too long where, patients it's kind of like a cable company. You know, you're not expecting to get good service. You're not expecting not to wait. When people have something called a waiting room, you're
Yeah,
going to
then
wait.
you're going to be waiting.
But that's something that we really are working on to be as respectful as we can. It's why we have the urgent care centers, again, because if you can provide 1,000 visits a week in a setting like that where patients are waiting no more than 10 or 15 minutes to be seen, you're also removing them from the primary care visits, which are also all fully booked. So by able to provide both, we're giving better customer access, we're giving better customer care, but it's not good enough yet. And I think we as an industry really need to get better at focusing on the patient. Too much is focused on the care delivery model. We really got to get that focus back on the patient.
Yeah, yeah.
And it's one of the things I'm very excited to be part of at Compass.
Really? Good.
Absolutely.
So Jamie, does Compass Medical have a mission statement?
Actually, I'm glad you asked that, Gail, because we actually went through a process with our entire organization last year where we pulled together a cross-functional team from really across the organization, including receptionists, medical assistants, providers, executives from the business office, to come up with what our mission statement would be. And they put together a number of different ones, and then the team put together a vote that the whole organization weighed in on. And we were excited to come away with a new mission statement to start last year. So Compass Medical delivers exceptional quality and collaborative care. We promote lifelong health and well-being to our patients, colleagues, and communities. And that's our mission statement, and I think it summarizes a lot of what we're trying to do. In addition, that same team came up with a definition of our values. And really what it comes down to is Compass Cares. And the cares is broken down into compassion, accountability, respect, excellence, and stewardship. And we feel like those are the things that really do demonstrate the values that Compass stands for. And I think it comes together nicely when you can say Compass Cares, because we do. And I think it's all about the care we provide, again, not just to our patients, but to the community itself.
Yeah, I like how you address the community and that it's a lifelong dedication, really, to the patients.
And the community is very important to us. We are not a Boston-based group. You know, we're as far north as Quincy, but we also have facilities down in Taunton and Middleborough and Halifax and Abington and Easton. And those are the communities we serve. We live in these communities. We see our patients in social settings. We are the community. And so for us, that's a very important component of the care we deliver. And I think it's embodied in everything. If you saw next door in the building we went to, it says a healthcare community on the front of the building. And that's what we consider ourselves to be, and that's where our patients are coming to us from.
Well, you have me convinced.
Excellent. So you're going to become a Compass patient.
I go home and, you know, in that regard, so you have a facility in Easton.
Correct.
And what's the address?
It's 21 Bristol Drive, right across from Stonehill.
Oh, it's right across from Stonehill.
Right across from Stonehill College, right off of Route 123.
Right, okay. All right, good. Wow, so that's easy to get to. That's right off of Route 123. And
if you're a Stonehill patient, we have a collaborative working with them with our urgent care center, so you can just come right across the street and be seen 6 days a week.
That is good to know.
No referral, you just show up in the urgent care and you can be seen.
Because you're a Stonehill student,
you can do that.
Stonehill
student that chooses a Compass primary care doc, you can just walk in and be seen right across the street.
See, that gives parents a lot of comfort knowing that their children can do that.
And it's part of why we chose that actual facility to put our Compass site at, was in collaboration with Stonehill and to be able to treat all those patients.
Wow, that's amazing. It's really good. Now, with all this technology coming forth and the doctor able to use the glasses possibly does that cut out a middleman at all? Do people, I mean, say the physician's assistants or the even down to the executive secretaries, things like that, they still have their part in this, right? It's not like
there's a role for everybody on the team. I think technology is best used when it's positioned to augment the care given as opposed to replace any
Okay.
care.
All right. That's what I
And
was
so
wondering.
that's what we're trying to do, is utilize the tools to provide the best care possible in a team-based delivery model.
Okay.
And so for that, everybody's got to play their part. And I think pretty much everybody at Compass would agree there's more than enough work to go around.
Okay, good to know.
Indeed.
And I like the team-based, what you said about that. And I see that in just the fact that you've included all different areas of Compass in coming up with a mission statement.
Yeah, well, and it's,
What do you think? What do you think? And so it is a team.
and it's the entire team. We have over 550 employees.
Wow.
And to me, that's such a wonderful wealth of information, of new ideas, of
yeah.
untapped potential to be able to be better as an organization and give better care for our patients. Because at the end of the day, everybody is a patient.
Yes,
And that's where
that's
it's
true.
easy to be able to step into the patient's shoes and look at something from their perspective, because we've all been there. We've all sat in the waiting room. We've
Yeah.
all been frustrated with subpar care.
Right.
And our goal is to take that experience, that learning from our own personal perspective, and make it better by applying that.
Yeah.
And technology is not going to do it. That's where the human touch really
Okay.
matters.
All right. Okay, good.
And where relationships matter. And that's what we're trying to do, is promote the relationship between the patient, the provider, but again, the provider care delivery team.
Okay, and that team, does that team have access to the patient portal? So if the patient is seen by a physician and then she goes to a specialist, can they use that portal to look to see what's going on, or is that not how it's
Depending
done?
on the specialist affiliation and which network they're part of, yes. Certainly
Okay.
for any care at Compass, if you were seen, let's say you worked in Quincy but you lived in Easton, and you were seen in the same day, something bad happened in the morning, you were seen in the Easton urgent care,
Okay.
and then you were at work and something went bad, you broke a finger, and
Yeah,
were
yeah,
seen
yeah.
in the Quincy urgent care.
Right.
All the same medical record information would be available to providers in both sites.
Oh, okay, so there's good communication.
Yeah, and that's what the technology
Right.
platform provides, is the ability to have information there. And frankly, it's one of the things that really differentiates Compass's urgent care from a lot of the other urgent care providers that you see popping up all over the place. They tend to only have their own electronic medical record. So when they're
Okay.
seeing you and treating you as a patient, they're not
Yep.
going to have access to your primary care medication lists and problem lists
right.
and past medical history.
All right, yeah.
We have access to that longitudinally through the electronic medical record, and that allows the providers to give much better customized
Oh,
care
yeah.
with far fewer mistakes,
Yeah.
because the information's all right there at the physician's fingertips.
And with technology, they just take a look at it quickly, it's right there.
Yep.
It's
and
not
for our
calling
primary
these
care
people
providers,
and-
they're the day before reviewing, the night before or the morning of, they're reviewing their patient list, the problems.
Is that right?
So that they're coming in not cold. And that's an important part of primary care, is being able
Yeah.
to plan for your patient's care. Harder in urgent care, where you don't know what's going to present from time to time.
Right.
But frankly, that's where the having access to problem list and medication list is even more important, because chances are an urgent care visit is going to be more time sensitive than
Yes.
the primary care visit that's scheduled weeks or months in advance.
Right, right. Oh, I like that. That's great. Well, the doctor can actually look and see, okay, this is what's going
Does
on.
so
and
much,
this is,
particularly with medications, to prevent counterindications and problems that are very avoidable. And that's what we want to make sure as a baseline. Avoidable problems are the ones that aren't on the table.
yeah, definitely. And you talked about a number of specialists that are with Compass Medical. So we touched upon the people that treat diabetes and others. Is there anything that you want to mention? There's behavioral medicine. Is there anything else that you want to mention as far as
Well, again,
specialists?
our goal is to provide a destination facility experience. So chances are, whatever you need, we're going to be able to provide at one of the Compass facilities, particularly the four that have the urgent care centers and have more specialty presence through our affiliation with Steward.
Okay.
So if you need it, we're going to be able to provide it.
Okay.
it might not be that day necessarily.
Right.
You know, in other words, we have a gastroenterologist on Wednesday, the orthopedists are there Monday, Wednesday, Friday. So it may not be on a Tuesday you're going to get that specialty visit, but within the week we can get you in to see pretty much whatever specialist you're going to need.
That's pretty good within a week.
It is, particularly when it's not Compass providers, but Compass affiliated providers through Steward Healthcare. And what's nice about that is we work with Steward to select the specialists that our primary care docs feel meet the quality thresholds we need to be able to work with
so you
them.
actually select them.
Yes, that's part of the advantage of the facility you were at next door. It's 70,000 square feet, and Compass is the leaseholder for the entire facility. We rent out about 30% of the building to non-Compass specialty providers. You saw the MRI. That's actually a Good Samaritan Medical Center magnet in their facility. But again, that's through our affiliation with Steward. And by doing that, we can select the highest quality of providers that work alongside our primary care docs in the Compass facilities to make sure that even when it's not a Compass provider, we're very comfortable and confident with the service you're going to get with the specialists that our Compass providers are referring you to.
I like that. I like that a lot. That's great. So you're getting really good care.
Yes, our docs won't refer to a specialist they don't think can provide the quality of care that you need as a patient.
Yeah, so you have good communication, you have a holistic approach, you have all the Compass cares and a great mission statement that tells everything what you're all about, and great facilities. It's just, and it's all in East. You have Easton, which is great because it instead of having to go, even though Brockton is just right next door, you get through the city and everything to get through there. But it's Easton, it's just really in your backyard,
really,
which is
less
nice.
than a mile from Route 24, which is what everybody down here is used to if you're living in the Eastern corridor.
Absolutely.
And so again, that's where the sense of community is important to us. We are not a Boston-based group. We don't, desire to be a Boston-based group. This is where our roots are, and this is the community we service, and this is where we want to be.
Good.
And we have the goal, the mission I had mentioned earlier, the values. We're also physician-owned. Our company is entirely owned by, there's 46 physician owners at Compass Medical. So that's who my boss is, our board of directors, who are all primary care physician or primary care eligible physicians. And they are the owners of the company. So we make decisions that are truly physician-led. A lot of people like to say we're physician-led. We're physician-owned and physician-led. And that's pretty rare in this day and age of healthcare, to have a group of 100 providers that are not owned by a hospital, but rather choose to affiliate with hospital partners.
That's a good point. Not owned by a hospital. And it's just, wow.
Yeah, it's a rarity. And it's really becoming more and more rare as we see mergers and acquisition continue to play out in healthcare, and some in response to the Affordable Care Act, but some just market dynamics as hospitals are feeling more and more of the pinch, and they view primary care physicians in particular as, the means to maintain their business in what is a shrinking industry. More and more is being done outpatient, more and more is being done in the home and at facilities like ours and endoscopy centers and surgical centers where patients don't need to go to the hospitals. And so as that dynamic continues to play out in healthcare, I think we're going to see Compass become more and more of a rare breed, but one who's growing rapidly. Our docs, we tend to attract a more younger, entrepreneurial-minded physician who wants to be part of the ownership of the company they work for, and therefore have a voice in the direction we go, and be able to, as we talked earlier, embrace technology and embrace the newest means to provide better care rather than wait for a hospital system to provide it for you.
You want to talk about the Affordable Care Act at all?
We touched on it earlier. I mean,
that
I have
there's
very
so many
mixed
more
emotions on it because while it's great that we got all these patients covered, the reality is the system is broken. And now when you get, we're booking patients out 14, 16 months in advance for physicals. And I mean, that's a real problem. But again, we are the canary in the coal mine in Massachusetts because we've had less than 2% uninsured since 2006. The rest of the country is now just starting to feel the impact of all these patients getting enrolled, but there's not a supply to meet the demand. So that's the real challenge with, because everyone, the Republicans are, Obamacare's got to go. And it's done with the right intentions. It's a good thing to have people get health insurance coverage. But it exacerbates an already broken system without really trying to address the root cause, which is there's not enough primary care access. We see chronic disease exploding. We see patients getting, more obese, more sedentary as technology anchors people to desks and social media more. It's almost like an immovable object meeting the irresistible force of supply and demand. Our need for healthcare, particularly chronic care management, is just exploding. But our supply is dwindling. Fewer and fewer primary care doctors are coming out of school every year because now doctors see that an orthopedic surgeon is making 2, 3, and 4 times what a primary care doctor is making. And so as physicians are choosing what specialty to choose, they're leaving primary care in droves because more and more of the administrative work of chronic care management is falling on primary care, and the reimbursement is skewed towards the procedural-based specialists, particularly surgeons, which are very important. We need surgeons, but we need primary care in managing type 2 diabetes as much, if not more, than we need experts at replacing joints.
Absolutely.
And that becomes a real challenge as supply just now gets completely outstripped by demand, particularly outside of Massachusetts, where we've been in this state for a while. But it's not getting better here either. It's not like we don't feel the crunch. We're seeing patient panels go from 1,500 to 2,000 to 2,500. And again, it emphasizes the importance of that team-based model of having nurse practitioners, physician assistants, behavioral health therapists to help bear that load of growing patient panels, of increasing severity of illness with a smaller and smaller number of actual primary care physicians to handle that. So I think, again, the Affordable Care Act was done with the right intention, and it's very important to get patients coverage, particularly for catastrophic illness, because we're seeing so many bankruptcies come from people unable to pay their medical bills. And that's just a horrible circumstance. And so getting insurance helps, but it doesn't address the key underlying issues that need to be addressed around supply and demand, and our system that, frankly, values treating sickness more than promoting wellness. And as you look at a fee-for-service mentality where doctors get paid for every visit they do, rather than a system that promotes wellness where physicians get paid for keeping patients healthy, for keeping patients from having to come see them, from ending up in the hospital. That's when I think we'll start right-sizing and attracting the quality and the volume of primary care providers that we need to meet the growing needs of chronic care illness management. And I think it will help fix what is a $3 trillion industry per year. I mean, we're going to be in 3 years probably...
3 trillion?
3 trillion. And we're probably going to be looking at 20% of gross domestic product by 2020, which means 1 out of every $5 spent in this country is going to be on healthcare. And that's really scary because we're not in the best economic situation right now as is. That's why we really view our mission as being critical of not just providing better care, but at a better cost. In the right setting. If a patient doesn't need to be seen in a hospital, we're going to do everything we can to keep them out of that setting. Keep them in a lower cost setting, or ideally keep them at home. And provide better care in the home, better guidance for patients on how to live their life in a more healthful way. And really look at trying to fix the problem, not from a federal top-down approach as the Affordable Care Act attempted to do, but from a grassroots level where the primary care providers are engaging the patients in their well-being, in their health, in their health promotion, so that we can get to a place where we really feel like we work in healthcare rather than sick care.
Yes, definitely. I totally agree with that, 100%. I mean, that, very well said. Well, I'm glad you're at the helm of this because you certainly talk passionately about it, and you, I think that it's going to go somewhere. I really do. I think that with you just seem to really know where this course should go, And you know
Well,
what I
believe it or
mean?
not,
And
I've been
how-
doing this for 24 years now.
Have you really?
I started in 1992. I've been at Compass for 12 years as the CEO.
Oh,
and,
really?
as I've always
That's a good
said,
long
I've
time.
learned more from my mistakes, particularly my more spectacular mistakes, than from my successes. And we didn't do everything right. We've learned a lot along the way. Each of those buildings we made a little bit better the next time we did
okay,
it. The
right.
6
Yeah.
buildings in 7
Yeah.
years. But most importantly, we have just a wonderful team here. You know, this
good.
really feels like a family of providers, of healthcare executives, of medical assistants and receptionists and nurses who really are all pulling in the same direction. And I
Good.
think a lot of it comes back to, as I had said earlier, that importance of being a physician-owned organization, as I do think they feel a lot more tied to the brand of care they provide, the brand
Yes.
of Compass. And like I said, we have 7 very dedicated board members, all of whom
okay.
are Compass physician owners. And we spend probably about 6 to 8 hours a month in board meetings, really plotting out the course for Compass Medical. So for me, it's a
Excellent.
lot easier to represent such passionate scientists and
Yep.
artists as our providers, not just our physicians, but our providers are. But being physician owned, it gives us the ability to plan our destiny and our patients' destiny with what's best for them rather than what political requirements might be.
Oh, yeah.
And that's an important distinction, because when you're an independent organization who's proudly affiliated with a quality brand like Steward Healthcare, but our brand of Compass Medical is what we're about, it's what we're tied to, and it's what we want to promote to our patients, so they understand that it's more than just a brand. It's a
Yeah.
quality of care that we want to provide. It's a community of providers and healthcare professionals, all dedicated to promoting better wellness for our patients, and doing it in a way where we're driving the chart so that we know that we're plotting a course that's right for our patients, not for any political constituencies that we're held hostage to.
Wow, well said. Yeah, that,
And our physicians really love it, because they feel like they are owners, and you can tell, you know, we're getting them all together tomorrow night. We'll have about 80 people in one room for 3 hours tomorrow night to talk about where's Compass going now.
is that right?
And we do that 6 times a year, 3 times a year with all of our providers, 3 times a year with just our physician owners. And again, there's 46 of them, so
Oh, there's 46 owners.
46 physician
Okay,
owners.
right,
So
yeah.
we get a lot of varying opinions
Yes.
and
Sure.
passion displayed at those meetings.
Oh, I'm sure.
So-
Which is good, though.
It's very good. We keep the
Yeah.
physicians engaged, the providers engaged, and ultimately, again, it's just better for the patients.
Absolutely. Yeah, because I can imagine that the owners, it's not all about business. I mean, it is partly about business, but it's mostly, like you said, about the patients and getting that care and keeping them well.
Yes.
Not just getting them well.
And we have some very
So-
smart physician owners who recognize the importance of having a equally smart, dedicated quality management team to do the business side. We don't want our physicians having to be day-to-day business people. We want them to be day-to-day clinicians providing the best care for the patients.
Right.
And we've amassed a really impressive management team and executive team who work tirelessly behind the scenes to make the brand what it can be, the care delivery what it can be, the facilities what they can be, our website and our public image what it can be. And all in all, it works. It works because we've got a tremendous team of dedicated providers, executives, and professionals across the board who all know what it means to be a patient and what it means to treat a patient.
Yeah, good. Wow, that is great. Well, that was a very,
Can't
very
think of
informative.
much more to talk about. I could opine more on healthcare policy in general.
Oh,
but
yeah, I can
bundle payments
imagine.
and chronic care management and all the new financial drivers that are coming into healthcare. I mean, there are some very exciting things, because everything I talked about with the sort of skewed reimbursement model that reimburses based on how many patients you see, and
Really?
a churn and burn mentality that isn't best for
Really?
patient care.
Of course not.
Medicare, Centers for Medicare and Medicaid Services under President Obama and the CMS Center for Innovation have created a number of programs like Bundled Payment for Care Improvement Initiative, called BPCI, Chronic Care Management and Transitional Care Management, TCM and CCM. These are new programs that Medicare has started up to incentivize a different way of collaborative care between primary care specialists and the patients
Right.
to promote better outcomes. So chronic care management really is just a way of structuring the documentation that physicians and patients do on a monthly basis when patients have 2 or more chronic illnesses as defined by Medicare. And so it's about 20 minutes of work a month that all the docs are already doing as part of management for any of these patients that have 2 or more of these complex illnesses. And that's so critical to getting our hands around the management of these chronic illnesses that finally, just last year, the Fed started reimbursing for better ways of documenting that care, better ways of communicating with specialists for bundled payment, better ways of looking at episodes of care, like a knee replacement. What is the total cost of that surgery for 90 days? The surgery plus the next 90 days. And can we manage that better? And I think that's exciting because historically, surgeons and primary care docs haven't had a lot of incentive to work together, particularly for patients after they have such a procedure. And a lot of them will tend to sit in skilled nursing facilities longer than they should, or have rehab or readmissions. And so now what the federal government is doing is recognizing there's better ways to do this if we create true alignment of incentives among the providers who provide the care, and make it equally important that the patient gets well, not just that the surgery went well.
That there's no infection, but now, what about rehab and all that stuff?
And avoiding readmissions, giving the patient better support at home, and in many cases, having patients go directly home after procedures rather than an interim facility. And that's not going to be right for everybody. It depends on your home setting. But people heal a lot better in an environment that promotes that. And if you have a healthy home environment that promotes well-being, you're going to do a lot better there than in what we'd hope is an antiseptic setting of a skilled nursing facility or a rehab facility. Give me that choice. Home, rehab, strange beds and pillows, any day of the week, I'm going to take
roommate,
the home off. Exactly. Never mind the potential for infections.
Scary stuff.
And
like you said, and it's part of the mind too. Your mind is, healing. Your mind really has to be in the right place too. So if you're at home and you're relaxed,
particularly if you have caregivers in your family who can help support you through what you're going through, as opposed to come and visiting hours in this alien setting. It just doesn't promote healing and well-being like a home environment can. And again, as technology gives us more ability to get care at home, I mean, Amazon has totally changed the way people shop. I don't think we should expect that technology isn't going to change the way people shop for healthcare and get their healthcare.
Wow, it's very interesting. I have learned so much. Jamie, Barber, thank you very much for the talk and that was so much information, really. It was great. I've learned so much, and thank you very much.
Well, thank you for your time. It's a very exciting time to be in healthcare. We love serving the communities we're in. We employ over 65 folks in Easton today at that facility, over 550 across Compass. So we're out in the community, we're an employer, and we want to be your healthcare provider of choice. So, check out our website, www.compassmedical.net, and come on back anytime. I'm always happy to talk about healthcare, as you can probably tell.
Very good. Thank you very much.
Well, thank you.
You're welcome. And that concludes this episode of Consider It Local. Until next time, I'm Gail Devens.